Hello ma'am, I am Angelique Verzola, BSN2B, and today I am going to show you how to administer or to apply topical medication. So the first thing we need to do, of course, is to gather our equipment. After gathering our equipment, the next thing we need to do is to check the medication order against the original physician's order according to agency policy. Clarify any inconsistencies and check patient's information for allergies. It is very important that as nurses, we need to check if the patient had allergies on or particular medication in order to prevent hypersensitivity or to worsen the condition or problem of the patient. And then, after that, of course, we need to know the action, special nursing consideration, safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. And then, we need to consider the appropriateness of the medication to the patient. Of course, medication are unique in their own ways. That's why we need to make sure that the medication that we are going to give or to administer to our patient is the right one, depending on their problem or situation. And then, after that, we need to perform hand hygiene. This is very important to maintain asepsis always and to prevent the transfer of microorganisms. And then next, we need to prepare medication for one patient at a time. This is to prevent any medication error. After which, we need to read the MAR and select the appropriate medication from the patient's drawer or unit stock. The next, we need to compare label with MAR, check also for expiration dates, perform calculations if necessary. And then, when all medication for one patient have been prepared, check label with MAR before taking them to the patient, and then return the medication stock to the patient's drawer. And the next is to transfer the medication into the patient bedside, keeping medication inside at all times. After transporting all medication to the patient bedside carefully, the next thing we need to do is to ensure that the patient receives the medication at the correct time. And then identify the patient. Usually the patient is identified using two methods. Compare information with MAR by checking the patient's name on the patient's identification band. And if the patient is unable to identify him or herself, verify patient's information with his or her significant other. So, magandang hapon. Ako nga pala si Angelique Verzola, your student nurse for today. And maaari ko po bang i-check ang inyong identification band? Ano ang inyong pangalan?
Verzola.
Okay, very good. Nasaan si mama mo?
Lumabas, ma'am.
Okay. Sa araw na ito pala, Ading, I am here to apply topical medication para sa iyong paa. Okay lang po ba sa inyo yun?
Yes, ma'am.
Okay. And then, after that is complete all necessary assessment before administering medication, and then check for allergy bracelet or ask patient about allergies. Don't forget to explain the purpose and action of each medication to the patient so that they can be aware and also to have a trust in you as their nurse. Okay. So, check ko lang po yung paa nyo, ha? Okay. And then, check ko lang allergy bracelet nyo, sir, ha? Sir, Ading, tatanong ko lang po sana kung may allergy po ba kayo sa Benadryl, topical Benadryl? Wala naman. So, we should consider the significant other, or we should ask the significant other if the patient has a um, um, allergy in a specific medication, specifically if our patient is still considered pediatric. Okay? So, ito nga po palang Benadryl, topical Benadryl is usually used, ginagamit siya to temporarily relieve itching and kapag may mga pain na nararamdaman tayo dahil sa mga minor burns or sunburns kami po. Okay? Okay. Okay, tataas ko ang yung padding ha. Okay. And then, the next thing we need to do is to perform hand hygiene and put on gloves. We need to use non-sterile gloves or disposable gloves if there is no broken skin. But of course, we need to use sterile gloves if we know that the skin is broken. This is to make sure that while providing care and service or doing procedure to our patient, we are still protecting ourselves as healthcare providers. Okay. Are you okay?
Yes, ma'am.
Dapat magpagaling ka na para makalabas ka na dito sa hospital. Okay?
Yes, ma'am.
And then after that, we need to wash, rinse, and dry the affected area with water and clean gauze. If the skin is very dry and flaky, we can apply the topical medication to the patient's skin while it is still damp. Okay. And then after that is to change gloves and perform hand hygiene in between. We need to use sterile gloves if there is open skin lesions. Okay. Relax ka lang, baby, ha?
Yes, ma'am.
Hindi naman masakit, di ba?
Yes, ma'am.
Place required amount of medication using cotton tip applicator. Note that cotton tip applicator is sterile and is for single use. And then let the patient know that the initial application feel cold. So, yung initial application ko nga pala dun sa medication, adding is malamig siya or cold, ha?
Yes, ma'am.
Okay. And then next is to apply the medication using one stroke. Observe the inner to outer application. Okay? Baby, So, how does it feel, sir? Ano pong nararamdaman nyo?
It's cold, ma'am.
Okay, that's good. And then after that is to observe irritation and redness. Okay? Next is, bebe, itaas ko lang. Itaas mo yung paa mo, ha? Thank you. Take out ko. Okay. And then after that, you need to discard all, after that is you need to remove gloves and discard all the materials used in the appropriate receptacle. And then don't forget to perform hand hygiene. And lastly, you need to document the procedure you have done to the client's chart. Okay, that's all, ma'am, for the application of topical medication. Thank you.